All right, we're live. Hi, Danielle. Can you hear me?
Hey,
Can you hear me okay?
oh, I can't hear you.
Okay. Your
Now I
video.
can.
Can you hear me now?
We're freezing. Sorry.
Um, for those
Uh-oh, we're
listening
freezing.
live, if you're tuning in, if you can let us know if you can hear us, that would be awesome. Can you hear me still? Can you hear me?
We're just freezing a little bit. So I can hear you. It's just freezing.
Okay. Okay. Looks like we're having some technical difficulties, but that's okay. We're going to go ahead and get started. So, for those of you who are joining us for the first time, my name is Winnie. I am a therapist and a life coach here at Thrive Unburdened. And I have with me Danielle, who is our awesome billing manager. A couple of weeks ago, we started a conversation about therapy and how to pay for it and afford it. So today we're doing the second part so we can continue with this conversation. We're pretty excited about it. It's going to be a very candid, unscripted conversation about therapy, how to pay for it, how to maximize your insurance benefits. And we're basically going to be
Mhm.
sharing a lot of the things that we've learned throughout this journey that will hopefully be beneficial to you, our listeners, who might be wondering how to go about paying for therapy. So that's the topic for today. Again, if you're joining us, let us know if you can hear us, since we're having some technical difficulties right now. Um, so Danielle, let's go ahead and get started. Can you hear me?
It's cutting in and out. But cutting in and out. But we're gonna do our best to kind of push through either way. Our purpose for this today is kind of to help you understand what you need to do to be able to start your therapy journey. Okay. So the title of our session today is Therapy and Luxury, right? So that's open. The answer is open to interpretation, right? Yes, because therapy is something you want, or let me rephrase, what you something you need to want to do. So it's not a need because everyone doesn't. Maybe at various parts of their lives, they may not need to be in therapy. But if there's something that you're struggling with, something that you want to work through, it does become a necessity for you. But with it being a necessity, you also need to want to do it. So, um, there's this misconception that therapy is for the rich, for the wealthy. That is not true. Therapy is for anyone who has a desire to take that journey. Um, it's a commitment on several levels, but anyone and everyone who desires therapy, um, for there's a therapist for almost anything. So don't think that your issue is too big, or your reason for this journey is too big or too small for you to start. It is luxury because you have to choose it. Same as, I made this statement the other day talking to Winnie, and same as you want to buy a pair of shoes, you have to decide, I want to buy those pair of shoes. Um, and there are things that go into you deciding to do that thing. So a luxury because it's not something that if that's what your life requires, but a luxury because it's something you have to choose. It's something you have to pick to do. Okay.
Mhm.
Um,
And I also want to add with our topic as far as breaking down that therapy being a luxury. Is therapy a luxury? Part of that conversation is because we feel like therapy in so many ways shouldn't be a luxury, in the
Correct.
sense that if you need therapy, you should be able to attend therapy. And it shouldn't be something that only people who have money, only the rich and the powerful
Correct.
should be able to attend therapy. So, in that sense, therapy is not a luxury, or it shouldn't be a luxury. It
Mhm.
should be accessible to all. So, that
Yep.
is part of what our conversation will be about, is to help you figure out, like, just give you some resources that you might be able to
Mhm.
utilize to pay for therapy should you need therapy. And before we dive into some of the specific points that we have prepared for today, I want to share. So last time when we had this conversation, we talked about budgeting for therapy, making a budget, knowing how much therapy you can afford per month, just like with anything else. Um, Danielle, you referenced the shoe situation. So if you're going to go shopping for you to buy clothes and shoes and everything like that, more than not, you're making a budget so you know how much you can
Correct.
spend, how much you're going to spend on your shopping trip. So that's the same concept with therapy and with healthcare in general. It's
Correct.
important to have that budget so you know how much you can afford. And I'll share a little bit about what my process um, was. So one of the things that I did when I was looking for a therapist for myself is that I looked up the rates for my locality
Yeah.
where I was going to be. So I did like a brief Google search.
Okay.
And then on Psychology Today, a lot of therapists came up. I mean, I was like, okay, a lot of people are listing these ranges. So this is what therapy in this area will probably cost me. So from there, I was like, okay, I need to budget X amount of money per month based on what I saw coming up on my searches.
Mhm.
So that's one thing that I did. The second thing that I did was I looked into my insurance to see if what I was going to therapy for. So that's one thing to keep in mind. When you're going to therapy, you're going to therapy for a specific reason. Danielle mentioned that you can go to therapy for pretty much anything that you can think of. So that will be your presenting problem, your presenting issue that you're going to therapy for. So I looked up my insurance, and I was like, okay, my insurance does not cover going to therapy for
Yes.
this
Mhm.
specific issue that I'm seeking therapy for. So
Correct.
then that um, eliminated me being able to use my insurance to cover for the services. And later on, we're going to go into details about insurance and everything like that. But just to kind of give you an idea of what my process was. So first, I looked up the rates for my locality. Then I checked into my insurance to see if that was something that my insurance was going to cover. Once I realized that my insurance wouldn't cover that, and as an aside, even if my insurance would cover this specific thing that I was seeking therapy for, I would need a diagnosis. And I knew that I wasn't going to meet criteria for a diagnosis. So even if my insurance covered this issue, knowing that I wasn't going to meet criteria for the diagnosis, I already knew insurance was out of the picture.
Correct.
So now it really came down to me budgeting and knowing what I could afford. And so
Mhm.
that helped me have a conversation with my therapist to figure out, okay, how often do I want to meet? How long are my sessions going to be? That really put me in the driver's seat of my therapy. So that's really what we're going to be talking about today is to give you some pointers, some tools, and some resources that you can utilize that hopefully will put you in the driver's seat of your therapy. Because
Right.
let's face it, mental health care, that's your personal health care. So you should be able to be the person to be like, okay, this is what I can pay for it, this is what I can afford. And you should be the one directing to a certain extent your care. So long story short, that was my introduction to kind of
Great
lead us
intro.
to to
Great,
some of the
great
points.
intro. Yes, absolutely. So, um, just to recap or to get into some of these conversations of the things that Winnie stated, some of the key things you need to ask yourself before you even, I would say, even before you go on your Google search to find a therapist is how much I can afford for therapists. I would start on a monthly basis. What can you afford for therapy monthly? I would ask myself and check, can I use my insurance? So just to throw something out there, very realistic example. If I am seeking therapy for anxiety, I need to know that if I'm using my insurance for this, that there needs to, this is key, there needs to be a diagnosis applied by the therapist for me to even go the route of using my insurance. So, but if it's something that's not of a clinical nature that you're seeing a therapist for, they determine that this is not something that really has a diagnosis code established for it, then that therapy session would not qualify for the use of insurance. So that's where it takes you back to point one of
Right.
knowing how much you can afford for therapy on a monthly basis. A monthly is safe because you don't know how frequent your therapist is going to have availability for you. You don't know how frequent they're going to recommend that you see them. So having a monthly threshold budget for that is the best way to approach the situation as a whole. And then what is your this one is very important to me, and I thought about this last night, is what is your availability for therapy? When can you do this? When can this fit into your day? That's important to having the conversation with the therapist about starting your journey. Because if you're only available, let's say you work a job where you work 10 in the morning to 8 o'clock at night, you need to be sure that those are questions that you're asking your therapist. What is their morning availability for you so that you can do it before work? Or, is this a therapist who has availability late for you to be able to do it late into the evening?
Or can you meet during your
the
lunch
middle of the
break?
day.
Right.
Correct.
Right.
Like, do you have a lunch break that you can use? Do you have, do you have flexibility from your employer or whatever it is that you do during the day, whether it's that you go to school or you work, you're at home being a caregiver? What is your availability during that day, and how that matches up with what your therapist has to offer in terms of the person that you are seeking to become your therapist? What does that mean for them?
Right.
As Winnie stated, you have to be in the driver's seat of this journey. A practice can make all the recommendations that they want to you. They can recommend that you see them on a weekly basis. But if that doesn't fit your lifestyle, you have to be in charge of saying, yeah, every week doesn't fit my lifestyle. Maybe every other week fits your lifestyle. Your therapist needs to know those things in order to properly schedule you, properly prepare for the journey that you two are going on together, in essence, right?
Yeah. And I had a thought, I want to share this really quick. When we're talking about scheduling and the availability, I'm not sure that a lot of people know this, but sometimes depending on the severity of your presenting problem, so the severity of the issue, if it's affecting your ability to function at work, your ability to function at school, you could potentially be able to get some of these absences excused.
Right.
So you can attend your therapy. So
Mhm.
again, this is why it's important to have these conversations with the therapist that you're going to be working with, because you never know, they might be able to help you get
Navigate. Mhm.
some sort of letter or something that you might be able to provide to your employer or to your school
Mhm.
if you're a school age client. We might be able to figure out, a way to advocate for you to get these absences excused so you're able to participate in your therapy. But if you don't talk to your therapist about these things, they don't know.
And
And
also, sorry to cut you off, if you're a
mhm,
school age student, and there's a level of transparency that has to come with this journey. So, we're not saying that you need to broadcast to the world what you've got going on, what you're
absolutely not.
um,
Mhm,
but there's a level of transparency that's necessary for people to be able to properly assist you. So if you're a school age student, you're in high school, this might be a conversation with your guidance counselor, because let's
mhm,
say your concern is, where do I do this therapy if I'm at school and I need to? There is going to be a space that they can designate for you to have some privacy and do this.
right.
And if you're on the school campus, it doesn't necessarily mean you have to leave and come back. But having these conversations with who your appointed guidance counselor is, the principal, vice principal, these people are here to help you navigate these things.
Mhm,
Get your parents involved. Your parents obviously are going to be involved. They
right.
can help you have those conversations with the guidance counselor, have those conversations with administration
Mhm,
to determine, hey, my kid needs to do this. The availability is just during the day. It's going to be, an hour lunch period or whatever. Is there somewhere that's secure, safe
right.
space for her to speak or him to speak and be free? I guarantee you, those resources are available. They should be available. Um,
Right.
they should be available for you to be able to navigate this journey, regardless of what stage of life you're in right now.
Yeah,
Um,
and I'm glad that you made that point, because I've actually coordinated with school counselors.
yeah,
Of course, with the proper releases in place,
mhm,
I've coordinated with school counselors um, so that they can make sure that if the student is doing a telehealth session, they have a private room that they can meet for the session. So these options are out there. We just need to know. And by we, I mean your therapist needs to know
mhm,
what's going on with you so they can know how to advocate for you.
correct.
Um, Cartessa made a comment that I wanted to go back to really quick. We were talking about, I think, accessing services or how to access services, I think. And she said that this makes me think of veterans and service members that have to wait for an extended time to receive services. That's a very good point. And when we're talking about insurances, in a little bit, we'll talk about that. But those are things that I know for us specifically, we've been able to work with service members who
Mhm,
are active duty or reserve to help them navigate this whole process,
right.
because it can be complicated with service members who are active duty trying to go see a therapist off base. That can get overwhelming. And I know that for us, knowing that this potential client is active duty and they need further assistance to help them get a referral or, things like that, we've been able to help service members navigate that. So I know that other clinicians are able to advocate for you and help you navigate those things as well. We
Absolutely.
just need to know.
Absolutely. You know, going back to advocating, you know, and we can stay on the topic of veterans for a while, for a moment. Um, it's not easy, right?
Hmm.
So you need assistance. There's loopholes and avenues you have to participating in
Hmm.
therapy with a counselor. Don't get discouraged. Um, the truth of the matter is, um, depending on the type of practice you link up with, the type of therapist, they're either the realistic thing is it's if it's a private practice, they might be doing it all by themselves and need you to really help facilitate that process, or it's a like Thrive and Burden. It's just a few of us, right?
Hmm.
So we're trying to navigate quickly all of these things for however many people on our own, but everyone doesn't have the luxury of a billing manager
Hmm.
or an
Very
administrative
true.
staff in their practice. So this is why it's extremely important, as the person, myself, as the client, as the patient, me seeking therapy, that I take the initiative in some of
Hmm.
these tasks. So
Hmm.
veterans, especially some of especially the active duty ones, if you are looking to have services off post, an authorization naturally is going, or referral is naturally going to need to be issued, and you will need to facilitate that. So you're going to contact your PCM. I think the acronym is patient
Hmm.
care
Primary care manager.
primary care manager.
Hmm.
You want to contact that person, let them know who you're intending on seeing for what, right? They will usually, used the example of anxiety before, they will usually apply a generic anxiety. A general
Hmm.
anxiety diagnosis code to go ahead and get that started if they're approving you to see someone off post, and that starts the process. Once that's in place, the clinician, whoever their administrative staff, if they have one, can go and follow up on those things if they
Hmm.
need the diagnosis changed, things of that nature. But I want you to absolutely keep in mind that sometimes these therapists that you are communicating with, it's a practice of one. So you're wanting to it's I would say, you've got to give a little to
Hmm.
get what you need out of the situation. So don't be discouraged by having to contact your
Hmm.
insurance to verify your benefits. Just do it.
Hmm.
It's important that you know what we know. It's important that you know that you've got to pay $25 every session if you're paying a copay. And it's not enough for me just to tell you it's $25 because I ran your benefits and I saw that. It's important that you know those details. And I'll use this as an example. I had a situation recently. I went to my son's doctor's appointment. They told me I owed a balance of X, Y, and Z. I didn't think about it. I paid the balance, right? A few minutes later, another clerk from the front desk comes to me and she's like, "You didn't have to pay this. You've paid this already.
Hmm.
You paid it included in another balance." So if you're just listening at you owe $25, but you've met your max out of pocket and now you actually don't need to pay us anything. You having that information for yourself is the difference between you paying me every time you see me, or you talk to me, versus you just having a free service
Mhm.
because you've paid what your insurance requires you to pay, and now you've got free service. So you've got 100% of your benefit being
Mhm.
paid. Um,
Mhm.
so it's important that you take up those reins and you understand and what this process and this journey
Mhm.
entails. So if you live in a particular area, like Winnie stated, for locality, look for therapy. It's important information. It's how you
Mhm.
set your budget for therapy, is knowing that you can pay as low as $60 if you got to do it out of pocket, right? You can
Mhm.
pay as low as $60 or as high as, for some places, $250
Mhm.
for an hour session. It's good for you to know that
Mhm.
information, because
Mhm.
if all you know going into your consultation with your therapist, and just for a moment, when you start looking for these therapists, not everybody has their rates published, right?
Right. Right.
So because everyone, so if you go to Blue Sky Therapy's website, Blue Sky Therapy may not have their financial breakdown posted. They
Mhm.
don't post what they're charging. That doesn't mean you shouldn't pursue the consultation. Yeah, go
Right.
forward with it. Let them know what you can afford monthly. I guarantee you, it's the smoothest conversation if you let people know. They're able to break down and say, okay, you can only afford X, Y, and Z monthly. That kind of fits into a 45-minute session weekly for me. We can do 45 minutes every week, and you won't exceed your budget towards therapy.
Right.
Be upfront, be
Mhm.
transparent. Therapists are transparent even though they don't post their prices. If you ask for it, there's no reason why they're not going to tell you
Well,
what they
we're actually ethically
ab-
obligated
obligated.
to let
Right.
you know
So,
what
so it's actually a
therapists
red
going
flag.
to cost. Yeah.
Definitely a red flag if you communicate
Can
with
you
a
hear
therapist
me?
to charge you. That's a red flag.
Yeah.
Um, I, I can. Hello, you're breaking.
Yeah. I can hear
Yeah,
you
it's
now.
a red flag if they're trying to keep it a secret. But it not being published is not the secret. Um,
Right. And
what
I
we've
also
learned,
want to
and
add. Oh, I'm sorry. We're talking over each other. I'm sorry.
oh no, it's
Can you hear
fine. It's
me?
because there's a delay. You're
Yeah.
good.
I was gonna say, by the same token, if you're looking for a therapist and you're on Psychology Today or on therapy for Black girls, or on a specific website and the rates are listed, that still doesn't mean that you're not going to be able to afford it, because you never know what options. Oh, sounds like we're having some technical difficulties again. Can you
No,
hear me
we're
still?
good. Sorry, that was me.
Okay.
We're
Yeah,
okay.
so again, just because the rates are listed, don't count yourself out for you to be like, well, their rates are listed as $150 per session. Well, I'm out. I can't afford it. You never know what options they might have available for you. And I also want to
Correct.
add that um, having a financial conversation with your therapist, or with their billing manager, um, that is a part of your clinical presentation, because let's face it, finances can affect our mental health. So these things, I feel like, go hand in hand. So when, again, you're wanting to start therapy, if you feel like finances are going to be an issue, please let your therapist know that's a part of what what's bringing you to therapy, perhaps. So that's important. Hi, Tiffany. Tiffany joined us, and Tiffany made a comment when we were talking about the insurances and stuff about community care. And when I read that, I'm not sure what you meant by that. But when I read it, I immediately thought of collaborative care. And
Mhm.
that to me means collaborating with you, the client, for your care. So, again, the whole purpose of having this conversation and this discussion is to provide you with, some tools
Familiar
that
options.
that right, that you might be able to use, so you're in the driver's seat,
Absolutely.
so you're able to collaborate with your therapist. Um,
Absolutely.
Tiffany was talking about for veterans seeking treatment outside of the VA. Correct. So community care might be an option. Okay. So
Yeah, community care definitely could be an option. There, you've got local um, social services that are available depending on where you are. Those are definitely options and things that we'll talk about a little later, because I would consider that going outside of your insurance to some degree. And we've got a little bit of information we'll provide
mhm,
on things to look into when your insurance is not an option. And that includes, if you don't want to see someone on post, what options you may want to look into potentially being available to you. So that would include the veterans and those who are our military service members. Go ahead,
mhm.
Winnie. You were stating something.
There's a question: having supporting resources near the client. Okay, maybe home-based services. Is there a difference for insurance with that type of community care? And Tiffany said that's who we get approval through. Um, so maybe we can dive a little bit into that some more later on. But Tiffany, thank you so much for the information that's coming through from you. Feel free to keep sharing with us. And thank you to
Absolutely.
Cartessa for providing these suggestions.
Yep,
Mhm.
absolutely.
Yeah.
So we stated we want to make sure we know how much we can afford because that helps you determine your frequency. Making sure you provide that information to your therapist or whatever combination of a consultation. I know for us at Thrive Unburden, if immediately following a consultation, the potential client has information that they're looking for information about insurance or finances. They're able to speak to me. They can call me. They can email me to for us to kind of walk through what their options are.
Hmm.
But even if it's a practice of one, a single therapist practice, they are able to. I've had consultations for therapy myself. They're able to tell you what they can do and what they can't do. And
Hmm.
it's a realistic conversation. Yeah, I can work with that budget that you have. We can do it this way. Or if they can't work with the budget that you have, they can make some recommendations. So those recommendation could include community-based options. Those
Hmm.
could be referrals to other therapists in their network,
Hmm.
that based on and I think sometimes a referral is the a beautiful thing because they've already
Hmm.
had a consultation with
Right.
you. They kind of can pinpoint based on the network of therapists that they have, who may very
Mhm.
well be a perfect match for you. So don't be discouraged if your consultation sounds amazing, but at the end, you're still looking into other options. That's okay. You started the journey. The starting the journey is key, and that part of that includes um, almost, I don't want to use the term shopping around because it can mean multiple things,
Mhm.
but sometimes it takes a couple of tries, it takes a couple of consultations, it takes a
Mhm.
couple of conversations for you to find 100% what works for you. What no therapist wants for a potential or current client is for you to start a journey and abruptly have to stop,
Mhm. Mhm.
because and this is why it's so important to know your finances and know what you can afford, budget this in, is because if you think you can afford, you say you can afford $300 of this month, and realistically you could only afford 150 this month, one the extra 150 is not going to fall out of the thin of the air, and that is going to make you have to stop.
Yeah.
um, Take into consideration what your finances mean for you, how those affect your reason for this journey for therapy in the first place, and don't fool yourself. Don't try to project having that under control if it's something you're still trying to figure out and
Mhm.
get under control. Um,
Yeah. I
there
want
are,
to add
go ahead.
really quick. Even though we're focusing mostly on private practices because that's what we are, um, I want to say that community mental health agencies are also great options for people as well. And
Yes.
even when you're
Yes.
going through a community mental health agency, these same principles need to apply as well. So when you're calling to make an appointment, you do need to find out if they take your insurance.
Mhm.
How much sessions cost. I mean, the same principles apply, but
Yes.
I just wanted to make that point really quick that even
Absolutely.
though we're focusing on private practices, mostly community mental health programs are available as well for people
Correct.
to access.
Correct. Yes. So since you made the statement of insurance, let's jump into that a little bit
Hmm.
more, right? So we get to the point of you've had your consultation with a therapist, you find out that my insurance right now is Blue Cross and Blue Shield, right? So I find out that this therapist does take Blue Cross and Blue Shield. I need to know, does my Blue Cross Blue Shield policy cover my mental health and behavioral health services?
Hmm.
This is important.
So
Um,
this applies to the specific plan under Blue Cross Blue Shield, right?
it's the product, so
The product. Okay.
it could be the product, it could be and sometimes products of that nature are state specific products. So
Okay.
maybe Blue Cross Blue Shield of this state uses or Blue Cross Blue Shield of this state, that particular product in that state um, carves out what they call as a carve out
Mhm.
their behavioral health. So what they do is, and it's usually if I and I don't want to misspeak any insurance people watching. I think sometimes when they do that and carve it out, it's cost management. So maybe it's for the employer who's purchasing the policy for their
Mm.
employees, maybe doing everything under the umbrella of Blue Cross Blue Shield costs X amount of dollars. But if they carve it out and do the mental health specifically through United Healthcare, they shave off a little bit of that cost. So they carve it out. So you can very well have an insurance card that says medical insurance card that says you've got all of these benefits covered. But when you really look into your benefits for that particular portion, whether it's medication or mental health, it may say that that particular benefit goes through another product. And if that's the case, now you're looking for your clinician to not only be in network with Blue Cross Blue Shield, but if the carve out insurance is United Healthcare, behavioral health, in order for them to file that claim to United Healthcare and then receive an in-network, not an out-of-network payment, they would need to also be in network with that insurance. Again, this goes back to knowing your stuff about your situation, your insurance, your finances. It's important that you know that and not just depend on the therapist or their administrative staff to provide you that information, because it's an easy thing to miss, because we can run the Blue Cross Blue Shield benefits. It's going to tell us you've got benefits, but if we don't, for 2 seconds, we miss that little part that doesn't show that mental health falls under that benefit, you will start therapy only to find out later that it wasn't actually covered. And, it's a dual error. We have to both take responsibility for that. The clinician staff or the clinician themselves did not properly understand what they were looking for. And you yourself didn't properly understand what you're looking for. I suggest not always going online and looking for those things yourself. Don't always go into your portal for your insurance and look at that stuff. Call someone, get a customer service rep on the phone. The easiest way to get it correct is to talk to someone and let them verbally explain to you what you're seeing. You're less likely to obtain the wrong information that way.
So just to make sure that we clarify this, and a question for you as well, maybe people watching this might have this question. So when we're talking about the insurances, when a client goes on Google, Psychology Today, wherever you might go to find a therapist, what I'm understanding from you is that don't just grab onto the fact that excuse me, this therapist says they take Blue Cross, or this therapist says they take Aetna, or they take United Healthcare, they take such and such insurance. It's important to know if your therapist is also in network or accepts the specific products of that insurance, because each insurance has different products.
Right. So let's use us, for example, right? We're in network with Blue Cross and Blue Shield, right? That's not enough for you to know. Your specific Blue Cross Blue Shield product. So you go to our website, you look us up on Psychology Today, Thrive Unburdened will show in network with Blue Cross and Blue Shield. That's how we have it posted. Your product has specific rules. So you may have a Blue Cross Blue Shield that says you can only, for instance, we're telehealth, right? You can only use this insurance for emergency services. There's products like that are just for emergency services. In order for you to get this mental health benefit, you've got to be in emergency. You have to be in a hospital. There are products like that. There are products that we are credentialed in multiple places. So let's say you've got a network, Blue Cross Blue Shield, that in essence says you can use your Blue Cross Blue Shield anywhere. But let's say your insurance has a specific stipulation of the that says no, for your particular product, you need to be located in the state of
Mm-hmm.
your product. So you've got
Mm-hmm.
Michigan Blue Cross Blue Shield. We only cover in-state benefits.
Mm-hmm.
If you're out of state, we consider it out of network. These things happen.
Mm-hmm. Mm-hmm.
So you could be a college student and your insurance is Blue Cross Blue Shield of Michigan. You're in the state of Florida. The therapist is in the state of Florida, but your Michigan Blue Cross Blue Shield says that it's considered out of network for
Mm.
you to see a
Okay.
therapist in Florida. They don't. That's just the product. That becomes a problem for you. That would mean that you may need to, though you're in the state of Florida, see if what your rules are in terms of maybe you need to get an authorization to do that.
Mm-hmm.
Those are conversations you have to have with your insurance provider to figure out what you need to do in those situations. And that's telling them, hey, when you call your Blue Cross Blue Shield of Michigan, hey, I'm in the state of Florida right now.
Mm-hmm.
What are the rules in terms of me seeking this service in the state of
Mm-hmm.
Florida? And
Mm-hmm.
I would say that make this your rule of thumb, regardless of whether it's mental health therapy or you need to go see a
Or
physical
medical.
therapist, right?
Mm.
Knowing what that means to what your product rules are is very, very, very important.
Mm-hmm.
And some of these things are far and few in between. Like it's not every single Blue Cross product that is
Mm-hmm.
this, but we've seen it enough times to know that it's something that comes up. So I'm very, and Winnie knows this, Blue Cross, she tells me we have a new Blue Cross patient or a client. I'm very meticulous
And I
about,
was like,
well, what does
let me
that
talk to
mean?
them
I need
first.
to look at these benefits. I need to make sure we're good. That this person can actually do telehealth. I'm very much so, because what I don't want for either for ourselves or the client is that we go on with this thing and then later we find out we didn't do it correctly. We needed an
Mm-hmm.
authorization. We shouldn't have seen you at all because your particular product, and this is any insurance, not just Blue Cross Blue Shield, your specific product is an emergency service only
Mm-hmm.
product, or it's only for there's preventative care, so
Mm-hmm.
you can only go see your PCP and your primary care under these things happen with
Mm-hmm.
insurances, because if it's through an employer or through a marketplace, you literally pay for the type of coverage you want to have. So your employer gives you options based on what they're willing to
Mm-hmm.
buy into for you. And then the same if you go out into a marketplace and you buy your own insurance,
Mm-hmm.
you paid for what you wanted to be able to
Mm-hmm.
have access to. So it's important to know that regardless, when you're doing your benefit selections at your job, that you are actually paying attention to the details in
Mm-hmm.
those benefit packets that they give you. I know it's time consuming to read, but it pays off later when you actually understand what type
Yeah.
of medical coverage you have, behavioral health coverage you have,
Mm-hmm.
who you need to call when you need to use those services, and if your clinician, your doctor, whoever it may be, needs to get authorization, where they go to get that
Mm-hmm.
information. You coming to us with that in hand saves a lot of time and energy. We don't have to beat around any bushes. We know exactly what we're expecting to do when we know as much as we need to know up front. Um,
Right. And
you
I
want
think that this also saves the client and the clinician from surprises down the road. I
correct.
think that you mentioned that earlier. The last thing that we want to happen is to assume that you've met criteria for this diagnosis, you've been assigned such and such diagnosis, and it's a diagnosis that your insurance covers, they're going to pay for it. Then 5, 6 sessions down the road, we get denials from the insurance saying,
Correct.
well, actually, we don't
Correct.
cover the service. Now, you're in a situation where you have a balance. You
Right.
owe your therapist a balance. Then it's like, now what? What do
Right.
we do?
Right.
Which there are options that your clinician can explore with you at that point. But
Right.
we would rather not, 5 sessions down the road now
Find out.
you have
And
$1,000 balance,
let's
a
be honest.
$1,500 balance.
Let's be honest. Sometimes it takes a couple of sessions before you even
Mm-hmm.
know what the insurance is doing with the claim, right?
Mm-hmm.
So we may be 2 sessions in if it's a insurance that it takes 2 weeks to get a response on a claim for. Most of them process these type of services really quickly, but it can take us 2 weeks to even know how they're processing that claim. So, and it shouldn't be the case, because honestly, like I said, the responsibility is a dual responsibility. It's our responsibility to know whether or not we need to be filing this claim to the insurance or not. But I want you to take those things into consideration, because
Yeah.
again, some of these practices are a one person show. They are seeing clients, they're filing their claims, they are following up on their claims, and that can stretch the time that it takes for them to get those type of details back to you. So knowing for yourself what to expect is key. It's important. You don't go buy anything, you don't go spend. We try our best in life not to go out and predict what we're going to spend. We go into the situation knowing what we would like to spend,
Right.
and in hopes that we stay within that thing. So we don't like surprises. We don't like surprising you in that way. A great surprise is, hey, your deductible is met, you don't owe us any more money.
You don't owe us money, or
Right.
hey,
But
we thought you owed this amount in copay. Turns out you're
you
actually
don't.
getting a credit.
We can credit your account. Those
That's a
are
nice
great
surprise.
surprises. But we don't want the type of surprises of, listen, your insurance did not honor this benefit. They're not covering it. You owe us X amount of dollars. Those kind of conversations are hard to have, and we try to do our best to look at all the details before you start therapy to make sure we don't run into those things. But I've had situations where the benefit changed. And you've got to know when your benefits are changing. If your insurance starts over in December, we're in the month of December 1, your insurance starts over. I mean, we've had clients who their insurance cycle starts over in the month of July. Everyone is not January 1 to January 1. So, if December I'm sorry, if November 30th is the last day of your old policy, and December 1st is November 30th is the last day of your old policy, and December 1st is when you start your new policy, you've got a new deductible to meet. We're doing our best to check it all before it happens. But again, you think about these practices where it's not a large staff. It may be missed. It's important that hey, my insurance, we've had clients do, my insurance is terming on X amount of date. I have a new insurance. Give us that information, because if we go file that claim to the wrong insurance and we keep filing it to the wrong insurance, we're going to
have a balance.
We're going to have a balance. It's going to take, you're going to get an invoice. You'll be confused. Not realizing you just didn't give us your new insurance, and that's it. And then when you're switching insurances, it's key to start that process again. Does this therapist that I've been seeing for months accept the new insurance that I have? that information you've got to be forthcoming about. So I don't want to stay on insurance too much. Deductibles, know your deductibles, know where you are in your deductible period. If you've got
Mm-hmm.
a $1,500 deductible and you haven't met any of it, we're no different than you going to see a specialist. At this point, we're a specialist. For most insurance policies, you're going to, there's some insurance policies that you don't pay your deductible for a PCP or for certain services. Know those things, because if
Mm-hmm.
not, we're expected to be treated like any other
Mm-hmm.
provider. Um,
Mm-hmm.
we are going to collect what the insurance says we should collect. And we expect that you are ready and have those funds available for us to collect.
Now, I think we're gonna shift gear just a
Yes,
little bit.
yes.
So, um, for clients who um, do not meet criteria for a diagnosis,
Mhm.
and thus they can't utilize their
Insurance.
insurance,
Yes.
or say the client finds a therapist that they really like, they
They
click
don't.
and they feel like this is going to be great, but the client has insurance, but the therapist doesn't take that insurance. So for those situations
Doesn't accept
where,
it.
right, so for situations where the client wants to use insurance but can't, or maybe the insurance doesn't cover it, and whatnot, what options do clients have at that point in time when they're going to be paying out of pocket?
They
How can they still benefit from their insurance coverage in these situations?
Okay. So in these situations, you want to do a couple of things. So we're going to use our practice as the example, because we're the ones speaking to you today. So you come to us, we're not in network with United Healthcare. Um, you still want to pursue therapy with Winnie.
Or Rhonda?
Or Rhonda, sorry, depending on where you're located. She's not on with us today, so I forgot about her. I apologize if you're
Hi,
watching.
Rhonda.
I didn't mean it, I promise. You want to see one of our clinicians. They don't accept your insurance. Again, this is where you need to go and find out what your options are with your insurance. A lot of insurance allow reimbursement to you. So we can send what is called at this point it would be what we would call a courtesy billing. We can send the claim to them. You would pay us the rate in full, and they would reimburse you at that point what is allowed to you. There are some insurances that we can actually bill out of network, and they will pay us directly. Those are hit and miss. So we
Mhm.
honestly like to at least that first session for us, we like to collect the full thing and then see
Mhm.
what your I will normally send it out as an out of network claim to see if maybe that insurance will pay us directly.
Mhm.
If they'll pay us directly, there's no sweat off of your back. They'll pay us directly. The reason we collect it is because some out of network benefits will send the check to the client to reimburse them. So that's why we call it a
The
courtesy bill,
courtesy
because
bill.
we're just sending it to
Okay.
them to get them the information, um, so that they can reimburse you based on what you paid to us. So you paid us $100, they
Mhm.
reimburse you 50. Or you pay us $100, they reimburse you 100, depending on, that's between your insurance and you and what your policy says in terms of how they reimburse you for
Mhm.
out of network services. The other
Now, for situations like this where you're submitting a courtesy claim, right? For
Mhm.
the courtesy billing, is a diagnosis required at that point?
um yes.
Okay.
um for if I am sending the if I am we the practice if the practice is
Mhm.
sending the claim to them, we need to follow those same guidelines, and there
Okay.
would need to be, there's no way I can get that claim out it's going to kick back if there's not a diagnosis.
Okay.
Now, in a situation where there's not a diagnosis, thank you, Winnie, because that segues into actually filling out reimbursement forms for the insurance. So there are some insurance that will reimburse you. You fill out a reimbursement form to say, I had this service done. That would be between you and them, whether or not they would need a diagnosis code. At that point, we would give you what is called a super bill or an invoice. Those I can generate. Most practices can generate and give you a copy of your invoice or your super bill to submit to your, almost like a receipt of what you paid. And at that point, they may reimburse you not based on the service, but because they've got some other type of methodology they use to say, okay, you paid for something out of pocket, we're going to reimburse you something. But I don't want anyone to think that they don't have options. You just have to know what your insurance options are. So if there's a diagnosis code, we will send that courtesy. We can send that courtesy claim. Assuming you give us the insurance to attempt to send a courtesy claim for you. I don't have a problem testing it out. Sometimes people like the submission or to submit it because it helps them meet their out-of-network benefit or their out-of-network deductible. And, we've had clients who wanted to meet their out-of-network deductible because, listen, I have to do this anyway. Let me just meet the out-of-network deductible, and then I get whatever benefit comes after that deductible is met, right? I get whatever discount comes with that. So if that's what you want to do, we don't have a problem submitting a claim so that you can ultimately get to the point of being at a 40% out of pocket or something like that. But we need to know that you want us to pursue that option. And we need to know that that's an option because some insurances don't accept anything out of network at all. And if that's the case, I will typically, at least for us, we will let you know there's not an out of network option. So you're paying this amount. So that's where knowing what you can afford is extremely important. So you can submit for reimbursement. Sometimes people have, I know, like if you've got like an AFLAC or like some of those accidental insurances, some of those insurances will, even if you submit receipts or if you ask for a claim, we can print it, email you a claim if you need it to submit. I've worked at practices in the past where people have incidental insurances and they call and say, hey, can I have an invoice so that I can, or a claim copy so I can send to my supplemental insurance or whatever it is that they have. So you just have to know that you have those benefits. It's no sweat off of our back to give you documentation to go provide to your healthcare provider or your, whatever entity is reimbursing you, so that you show proof that you paid for this. This was the service. This is the type of service. And if it qualifies for you to get the reimbursement, you get the reimbursement. So other things that you can do if you don't have, we were talking about still utilizing your insurance, even though we're not in network. So those are your options. Sometimes
and I want to say quickly that I don't want to speak for every clinician out there, but I think that for most clinicians, if you're wanting to use your insurance benefits out of network, I don't see why a clinician wouldn't be able to provide you with at least the super bill or the invoice so you can submit that to your insurance.
Ask for it.
Just ask, and they should be able to do that. I do want to say though that from some of my own research is kind of researching different therapy options that are out there. I have seen some language on some of the different therapy providers' websites saying that you don't want to use insurance because insurance is, all bad and everything like that. They're going to have your medical information and all that kind of stuff. I've also seen language regarding, well, even if, insurance were to cover this, it might take a long time for you to get reimbursed, or don't even bother going through insurance to try to get this covered, because what you're paying us would be significantly less than
Right.
you paying like a copay or something like that. So there's a lot of different information out there, and my reasoning for bringing this up is to let people know that therapy is a service. It's also a product, and you're the consumer of that
Correct.
product, and
Correct.
you need to know what you're looking for.
Yes.
And if a specific product is telling you, well, don't even go through insurance because they're going to have all your information, and that might cause, issues down the road, things like that. Just pay us $300 a month. That's going to be less than the cost of you utilizing your the insurance to begin with. Well, take a minute, like push pause just for a little bit so you can get the information for yourself. So
Right.
this is the reason why Danielle just went into details about how you can go about finding some of this information, because you never know what options
Are available to you.
you might find.
Yeah.
There are some great options out there, and there are some services that I've seen that don't provide clients with paperwork that they might be able to utilize to get reimbursed
Mhm.
for these services. So you're the consumer of the product. Make sure
Yeah.
that you're doing the research. Know
Yes.
what you're looking for.
Yep. And um let me
Tiffany says, I have read that in some states, if you have Medicaid or Medicare, you cannot private pay for therapy. Can you shed some light on this?
Very true. um, Medicaid, you cannot. Medicaid, the rule for Medicaid is that you need to. So let's go. Let me step back a second. These are government funded programs, right? So Medicaid, typically you've got to fall into if you're financial based. That's the reason why you have Medicaid.
Mm-hmm.
You are basically saying I fall into a particular threshold of affordability, and this is why I have Medicaid. I understand people have these benefits for other reasons. There's these benefits for disability
Mm-hmm.
and different things. But when you fall into some of these programs, or you go into some of these programs, um, they're set up for you to stay within these programs.
Mm-hmm.
So you need to go see a Medicaid eligible provider. So a provider that's in your network for Medicaid. Medicare and Medicaid, not so much. I don't think the rules are as strict for Medicare as they are for Medicaid. I could be I the government insurance says I don't quote too much because the rules are so you need to
Mm-hmm.
highlight and go through them. I don't want to misspeak. Medicaid is definitely more strict than Medicare, because I would say you probably have a wider net of providers that probably accept Medicare,
Mm-hmm.
whereas Medicaid is not one that a lot of people accept. So you would probably see more of an issue, or see this come up more for Medicaid. But no, they are not supposed to, clinicians are not supposed to accept Medicaid recipients as private pay. Here's the trick with that though. That's if the person tells you they have Medicaid, right? Because Tiffany, a client can come and they can say, I don't have insurance, because they already know you don't accept Medicaid. They looked it up. They know you don't accept Medicaid. They're not telling you that they're a Medicaid recipient. That there's no digging in the world that you can do to find out that client has Medicaid if they didn't tell you. So they chose themselves to omit that information. I think it's safe for practices to have questionnaires that clients sign off and say, I don't have insurance, because if that ever comes back and bites you, at least this person omitted that information. They signed off on it. I think we have disclosure forms. There are people who, if you are accepting a client who is choosing, I've known of opt-out forms that you can provide. Opt-out forms are really supposed to be used with commercial insurance. You really shouldn't use them too much with the government insurances, so like the Medicare and the Medicaids. But you definitely, the opt-out form. So I have Blue Cross Blue Shield, and my clinician accepts Blue Cross Blue Shield, but I don't want to go through my insurance. You want the client to sign off saying, I don't want to use my insurance, even though I know you're in network, because for them, whatever it may be that they have a super high deductible and they don't want to meet they don't choose to ever meet that deductible. You want it clinically documented that was their choice. You did not tell them to do that. You didn't coerce them to do it. They chose to do that. I shy away from doing those kind of things with the Medicare and Medicaid, because they've got a really good established network for them to stay within. And I know it's, maybe they don't like their options, and that's hard. Maybe there aren't as many options for them in terms of what they're looking for. But it's a slippery slope if later all of a sudden they're like, oh no, I can't afford it anymore. I want to use my Medicaid. And there's all this extra stuff that comes along with that. But yes, so I don't know if it's a state specific thing. I think it's Blue Cross. I'm sorry, not Blue Cross, Medicaid. I think it's in general.
It's a federal rule.
Yeah, I think it's a general rule for the most part. I would definitely look into whatever state you're located in, that state's rules in terms of Medicaid and Medicare, and what you need to do. If the state does say that it's okay for you to see them private pay, what documentation you need to have in order to go forward with that. Yeah. And yeah, they get upset. But let's be honest, right? So if I keep talking about budgeting, if I tell you I can only afford $150 a month, I feel like this is what these insurance policies are saying to these clients. You are income, you're living within a particular income. These are income-based. A lot of these things are income-based programs. So if you're telling us that you can now afford to pay for these things out of pocket, maybe you don't qualify for these income-based programs. So, I mean, obviously we're not going to throw those kind of things in a client's face, but it's why I feel confident enough saying, shy away from it if you can help them find someone who does accept Medicaid. We talked about community-based programs and local services. A lot of those community-based programs, agencies, stuff like Medicaid. That, they do take Medicaid, and it will take them a little longer sometimes to find that person that they match with. But those programs exist for those reasons, and they have to look at it that way. This is for you. This is built for you to use this service, and you just need to take the time. Just take the time to find. Winnie comes from community
Mhm.
agency background, right? So it exists. There
Mhm.
are good therapists. There are people out there that you can definitely. I refer. I get it. So yeah.
Yeah, and
So I get it. Like in
yeah.
those rural areas, they're probably very much so limited to their options. So they may match up with you and they struck gold. They feel they struck gold. And only to find out that they can't. And I think sometimes that's why they omit that information. They don't want to
Mhm.
tell us that they have Medicaid because they fear being turned away. So maybe they choose to do the cheapest version of service just so that. And I get it, like we need these services, but I just think about it. Imagine me needing hour sessions for whatever I need to take this journey for.
Mhm.
And I'm shortchanging myself because I really can't afford to pay this out of
Yeah.
pocket. And I'm stretching myself because of my desire to do it private pay. And it's actually causing me
Yeah.
more stress to
No, it
do
might
it.
be exacerbating
It
your
is,
symptoms.
right?
Yeah.
So I would always, try to encourage them to stick it out, try to figure out how to make those programs work for them. And there if you don't mind me going into this, there are foundations, there are other
Mhm.
options that you can tap into to help pay for those things, to help get you
Yeah.
those discounts. There's the open paths,
Mhm.
and I'm just calling out the ones I know. There's other
Yeah,
ones.
so that's actually the last piece of what
Yeah.
we're going to be talking about before we wrap up. So for people who don't have insurance, how do you pay for therapy?
Well.
So you mentioned Openpath. What's
um,
Openpath?
so Openpath Collective is an organization that basically you pay a subscription for. I think it's like what,
Yeah,
$59 or something like.
$59.
And basically, you submit an
That's a
application.
one-time
You pay a
subscription fee, I think.
one-time
Mhm.
subscription, and what they do is you get now access to a network of providers who have um, placed themselves on a list to take these discounts. I think a lot of providers who list themselves through Openpath are using it as part of their sliding scale. Um,
Yeah,
and what a
and
sliding
that's
scale
basically what it is, right?
Yeah, it's a sliding scale. So what a sliding scale is, I may explain it wrong, so you correct me. A sliding scale is basically a way for that providers reduce costs to you. So
Mhm.
my service is usually this month much because of circumstances. I allot myself X amount of slots where I utilize these discounts. I provide discounts. So it could be through Openpath. I think it's a great way for provider, if they're struggling to figure out how to do a sliding scale and those
Mhm.
numbers work for you through Openpath, to use that as a sliding scale. We've had some clients that we utilized Openpath for, and for the clinician, it's not something you have to keep up. So you can have it up. Correct me if I'm wrong, Winnie. You can have, you know you can do 6 month where you're live, and then you can take it
Mhm.
down if you don't want to accept anymore in that period
Yeah,
of
so
time.
it's basically a directory of providers similar
Correct.
to Psychology Today or Therapy for Black Girls or
Mhm.
some of these bigger therapy directories that we see a lot. It's basically the same thing. The only difference is that the therapists who sign up to be open path providers agree that they will
Those
see
rates.
the client for rates between I think it's like
30
30
to
to 60 or
It's
$80.
I think it's 60.
Yeah, but it's those rates are
Yeah.
well below like the national average
Right,
for what
right, right.
a typical hour of therapy would
Correct.
cost. So those are really great options for people with limited incomes.
Right.
You know that I can't afford 70 to 200 something dollars per session, then that might be a great option for you if you don't have insurance.
And for those of you listening, that may be patient clients, your potential clients. It's okay to ask the therapist during your consultation, do they accept or participate in Openpath?
Yeah,
Any of you,
and just a thought, even if your provider is not listed on Openpath, that doesn't mean they don't have a sliding scale or
right,
different options for
right.
you.
So
Um,
you have a
they
sliding
might
scale.
have a
Yeah,
sliding scale, right? That's just not listed, but that's an option.
yeah,
Some clinicians have X amount of pro bono spots per year. Um, Depending on your situation, you might get one of those pro bono spots. And
yeah,
pro bono basically means for free. So you get therapy for free if your clinician feels like you really need the service. However, because of your financial situation, you can't pay for it.
right,
So your clinician might decide that they will still see you and you don't have to pay anything.
right,
But again, this goes back to what we started talking about at the beginning of this talk. You need to have that conversation with your clinician,
right.
and you being able to afford therapy comes from you knowing what your budget is. What can you pay? What
Absolutely,
can you afford?
absolutely.
And then another option could be the a financial discount, right? So
Financial discount.
um yeah.
We have, at least for us, positive other practices may do this. If you are willing to be transparent, we have a financial discount application where you fill that out and we've got a set of rates at a discount. So some places call it charity discount. I don't know what the language is, but
Discount
yeah, the
application,
discount
sliding scale
application, sliding scale.
application. Yeah.
You just need to know if the numbers don't meet your specific financial ability to ask these clinicians, do you guys have discount programs? Do you have a discount option? If they have one, there may be some things they want you to fill out to show that there's a need for that. And that requires you sometimes, I think ours, we ask for a pay stub. We just want to give everyone the same,
A
um,
fair chance.
a fair chance. So if we're offering a discount, we ask everyone, that we're giving that application to for the same thing. And, you fill in, it's much like you would apply for any other type of assistance. What your monthly finances look like, what's your total household, and we use a scale that's much like how a Medicaid
Hmm.
would assess those things to determine if you qualify for that discount. When we get a client who the monthly um, uh, availability for funds is not really looking like it's going to work out for them, or we're concerned that this may lead to, and really early, like from a consultation, the first two conversations, I present that. I'll ask Winnie, do you think this person we can try the discount program for? And we'll give them that application. Now, if your application is not accepted, we don't say, hey, we can't do anything for you. We look at other options. Hey,
Yeah.
maybe all you can afford is twice a month, biweekly. We can do that. We can say, let's start with once a month, where the clinician has to be honest with me when I make a suggestion like that is that down the line, if that once a month you're not breaking any type of ground because it's just not enough, we need to go back and reevaluate what suggestions, what options we placed on the table for that particular client, because we want to be realistic about your journey. We want your journey to actually benefit you. And in order for us to do that, we have to be honest with you when your journey is,
Right.
let's say we're not doing enough,
Yeah.
and we can be honest if we're not doing enough because, we need to see you a little more frequent than we're seeing you right now. You may need to, as a client looking to, if you want to stay on board with that clinician, look into some options to support you financially. There are one that we've worked, had a couple of clients work with, is the Loveland Foundation.
Mhm.
They actually have quarterly, I think it's quarterly,
Yeah, I think
um,
so.
um, application openings. So you apply for the assistance, the therapy assistance, and if you fall into the availability of funds, they will. I think they give you 4 vouchers
Yeah.
each time towards therapy. That has been helpful to a few of our clients. It has
Mhm.
gotten them um, really close to where they need to be. I mean, we've honestly had, and that is not for clients that um, don't have insurance. We've had clients who have had insurance
Yeah.
use it to pay for their copays, and it got them to a good place without having to pay a copay. So there are other, I'm sure, organizations out there that support
Mhm.
people in these financial journeys, because I think we're in a part of our culture of the world where I think mental health is on the rise. People
Mhm.
understand the importance. I
Yeah.
think within ourselves, we're identifying the importance of our mental health. And because of that, more and more people are creating opportunities to help people
Absolutely.
on those journeys. So it doesn't cost you anything to ask a therapist if they have
Right.
a sliding scale. Do they have a discount program? Hey, I can only afford $200 a month. Can you tell me how? I really want to work with you. Can you tell me? Can you help me figure out how we can go about that?
Right.
Um,
And
and go ahead.
I want to make two points before I lose my thought.
Oh, you're good.
When you were talking about the frequency of the sessions and based on what the client can afford, I want to make a point to say that as much as we want to be able to honor what the client can afford per month. If you remember, listeners, at the beginning of this, I had mentioned that the financial situation can be a part of the clinical presentation, what's bringing
Mhm.
you to therapy. Let's say you tell us that you can only afford $200 a month. $200 a month will, if you're presenting with debilitating anxiety, so we're going to stick with the anxiety diagnosis that Danielle was talking
It's
about. So
cool.
you're presenting with debilitating anxiety that's affecting your social interactions, it's affecting your work, it's affecting
Mhm.
school, it's affecting your functioning in these different areas of your life. And the clinician feels like, you know what, like because of the intensity and frequency of your symptoms
Right.
and the level that it's affecting your functioning, the clinician can recommend that you start out meeting weekly. Now you can only afford $200 a month. So this is where the clinician has the ethical responsibility to decide, am I going to, meet with this client once a month or twice a month, knowing that that's
They
not
need,
sufficient to
right.
meet your needs?
Right.
Or am I going to figure out some sort of
Payment
payment plan
plan
or
or
some kind of something with
yes.
you to where you're getting what you need? Or am I going to refer you to a different provider that I know perhaps might be able to, one, take your insurance, or
Right.
they might be able to have several sliding scale spots to accommodate you. There are these different things that, as the clinician, I am required to make that clinical recommendation that's ethical. And so, again, that financial conversation is important because I need to know, your clinician needs to know. And some of the referrals might include referring you to other community providers, or referring you to a community mental health clinic, or some kind of, maybe you know there's a free program in the community that I happen to know about, and I
Mhm.
know that it is going to benefit you.
Benefit
Then
you.
I have that responsibility to
Mhm.
make sure that what I'm recommending is not only clinically sound, but it's ethical,
Right.
and so it all benefits you at
Right.
the end. But if I don't know that you have financial constraints, and I feel like because of this debilitating anxiety, I need to see you weekly, that's the recommendation that I'm
Correct.
going to make.
Um,
So you need to let your clinician know
yeah,
that.
you
So
have to
that
let
that's
the clinician
yeah.
know.
So I wanted to make that
Oh,
point,
no,
that
no,
that is
absolutely.
very important. The other thing that I wanted to mention, when you were talking about with Loveland Foundation specifically, and I am sure there are a lot of resources out there that people might be utilized to get vouchers, free therapy sessions, things like that. When clients were able to use some of these vouchers along with insurance, and I might go on a little bit of a tangent here, but
That's
bear with
fine.
me. Um, this is kind of where I get a little bit bothered when I see different platforms or websites telling people, well, don't even bother going through your insurance, because what you're paying us will be way cheaper than you paying a copay for you to be able to use your insurance. I have a problem with that, because we have had situations where, um, you know, client, you're presenting with symptoms that check all of the boxes for a DSM-5 diagnosis. You meet that criteria, you need the care, your insurance can be applied, and hello, you have a voucher or some sort of
Right.
other financial assistance
Right.
that can cover some of your out of pocket expenses. Now,
Right.
you're receiving therapy basically for free,
For free.
but there are sources out there telling
Right.
you it's bad for you to use your
And
insurance,
and
just
let's say
pay
you
out of
didn't
pocket.
let's say you didn't have the insurance, that voucher would not have gone as far as it did,
Hmm.
because that voucher would be taking up more of the funds that are now needing to go to the clinician. So I get to play devil's advocate here. I get some of the
Hmm.
frustrations. No, let me say it from my perspective. I get, because I deal with the
Hmm.
frustrations of insurance. I get how that can be frustrating. I get how that can be tedious for someone who doesn't do it on a daily basis, right? Or doesn't want to do it on a daily basis, because some of that is a want. I don't want to deal with insurance. I just don't want to do it. It's not my preference. Um, I get how those things can come off. But if our goal as therapy practices and therapy
Hmm.
providers and mental health and a mental health industry is um, to help people navigate these things and get them well and get them better, we cannot shoot down their only option.
Mm-hmm.
And if their option is for them to use insurance, and that's just not your thing, that's not what you want to cater to, is the insurance, the clients who have insurance, say that. But for the narrative to be that insurance is no good, they don't pay, they don't pay what your rates are, but they pay.
Yeah,
And
and I also want to add like just another point to that, because I have gotten, oh, that just reminded me of two things actually.
Mhm.
So thanks for
You're
yeah, thanks for that. So I have gotten questions from potential clients and from clients in general. Well, if I use my insurance, will that affect me later on? Because the insurance is going to have information about
diagnosis.
my mental health and things like that. If I want to get a job, like how does that? So think of it this way: you utilizing insurance for your mental health care is the same as you utilizing insurance for your medical care.
Yeah.
The insurance or an employer, depending on, you know, the job that you're applying for, they can't just be like, well, we're not going to hire you because you were seeing a therapist for
For
anxiety.
anxiety.
um
No.
Again, depending on the employer, depending on the job,
Right.
there are jobs, there are situations where um they will ask you about mental health. I mean, for our clinical licenses, for my license, they ask, do you have a mental health diagnosis? What is it? Are you managing your mental health and everything like that? The key is, if you have a mental health diagnosis and you're applying for a job, if it comes into question, the only way that I feel like it would matter is if you have a mental health diagnosis that is not being managed.
Correct. It
There's a difference.
it
So
hinders
if
you from doing the job.
right,
You
right. So
Yeah.
if it's hindering you from completing the job, if you're supposed to be taking medications, you're not taking medications, things like that. If it's impacting your ability to do your job, that is the only time when a question about your mental health should
Mhm.
matter, just
Yeah.
like any medical condition.
Any other medical condition.
Is your medical condition impacting your ability to complete this job? So that was one of my little
Oh
soapboxes
no, you're good. But you know
that
what?
I just wanted to
I think it's
um
so important that that we understand that a diagnosis, whether it be for mental health or something like, I got bad ankles. I don't know what you would call it, right? Um, whatever my diagnosis is, it's a medical diagnosis. It's so
mhm,
that on paper there's documentation of what it is that I experience, what I go through. Sometimes these jobs want to know this information because they need to make certain arrangements for you. So like if you do need to be medicated, if you do need to have these things, they just need to know, right?
right.
Because it sometimes it helps explain certain things. Not because they're using it against you or they're using it to keep you from getting the job, but maybe knowing that you take medication, and let's say that medication makes you drowsy in the first hour that you take it. I think that's important for an employer
Mhm.
to know, because maybe they need to schedule you um, after what your your time period. You know, there
Mhm.
are different reasons that that question would come up. But a diagnosis code is not a mark of the beast. It's not it's not to make you any less than what you
Mhm.
are. Um, it's a way to identify what things need to be managed.
Right.
When someone is a cancer patient, they need to be diagnosed to know what type of cancer they have, so they know how to manage that, how to treat it, how to get themselves
Mhm.
better. So
Knowing what your diagnosis is, or knowing that you have a diagnosis,
mhm,
helps direct your treatment.
it
So,
does.
basically, if yes, thank you, Tiffany. Also, some diagnoses fall under the ADA protections, and
Correct.
employers have to make accommodation. So,
Correct.
again, if you're afraid of using your insurance because the insurance is going to have your mental health information, well, they have your medical information anyway. So, I
Yes,
I tell clients, you having a diagnosis, that is not a bad thing.
it's
It's a
not.
diagnosis. And
It's not.
in a lot of situations, for a lot of clients, when you finally have the right diagnosis, it can help you understand what's been going on with you.
With
It
yourself.
helps
Yep.
us figure out what your treatment goals need to be, what
Yep.
we're going to be working on, and things like
Yep.
that. So it's not always a bad thing.
It's not.
Um, and I've gotten questions about, well, what if the insurance wants to see my therapy notes and things like that? And that is probably a different topic for
A
another
different day.
day. But
Yeah.
my point is to basically say, if fear of insurance having your information is the reason for not using your insurance, it's probably um, not a very good reason not to use your insurance benefits. I understand the fear. It's a very valid fear, but at the same time, please don't let it stop you. If you have the insurance benefits and you qualify
To use.
for a diagnosis and for you to use it, do not let other people scare you into not using your insurance benefits.
And I want to encourage us to stop making mental health this separate thing, as a whole, because when it comes to your health care, and mental health falls into your health care as a
Mhm.
whole, it's your health. You should not, anything that has to do with your health and your well-being, you should not be afraid of anyone telling you, or helping you identify what it is that is wrong. If I've got a pain in my stomach, I should not be afraid for a doctor to tell me that you've got a stomach ulcer.
Yeah.
I should not be afraid to go and see that person, and them help me identify what it is that I'm experiencing, what it is that I am going through.
Mhm.
Um, because that identification is going to lead to a healing. It's going to
Yeah.
lead to my wellness. And if the objective is good health and wellness, we cannot be afraid for someone to call out a diagnosis. We will need to do it because we're definitely over time.
Yeah, way
We
over
will
time.
definitely way over time. But I thank you all who are watching for watching,
Yeah.
and sticking it out with us. But definitely the documentation things. Listen, um, the healthcare policies are not to be toyed with. They these agencies make it very, very expensive, I will say, for any type of healthcare
Mhm.
entity to mess around with your information. So if I
Mhm.
don't need to see Winnie, as a billing manager, I'm in administration for the practice, but I have no reason
You don't see my notes.
to go look
there's
at
there's
Winnie's
a
notes.
reason.
There's no
Yeah.
reason for me to go look at Winnie's notes. There's and there is, it's so much so that even the platform that we use, if I were to be able to have access to said notes and go into that notes, there is a log of why I'm in there. And I now have to answer to her or whoever else, if that information is compromised, to say, why was I in there? Right.
Mhm.
So These practices ethically, the have to protect your information
Yeah.
because their license is on the line if they don't.
Mhm.
And
Mhm.
I don't know that any practice, any clinician is willing to risk their livelihood for just giving out your information for free, or I don't know what they gain from giving your
Yeah.
information out, right?
Yeah.
So let's work on as a healthcare industry, as mental health industry. I would say the work is us figuring out how we can break some of these stigmas. Diagnosis codes
Mhm.
aren't bad, insurance isn't bad. Diagnosis code, we need to call diagnosis codes and DX codes what they are. They're identification codes. They tell us exactly what a person is dealing with, and it helps us figure out based on that thing what we need to do to help them solve it.
Mhm.
So before we, Winnie, I don't know, wrapping up, there were a couple of other things I wanted to say in terms of
Mhm.
options to afford insurance without, afford
Therapy without
therapy
insurance.
without insurance. So you've got your local services, your community-based options. You've got for students, I want you to know that your universities,
Mhm.
there may
The
be
university
options
counseling centers.
in your university counseling center. So try that. Students, we're fit. You're on fixed incomes. You've got to ask mom or dad to help if you need to do anything additional. Your financial aid is locked into paying for the things that it pays for. Look into what options you have on your campus for counseling, right? You've got hotlines. I cannot call them all out. We have some listed on our Thrive on Burden website. There are hotlines
Mhm.
that you can call to speak to
Yeah,
someone.
the
Um,
suicide prevention hotline.
yes.
There's NAMI, the SAMHSA hotlines. There are hotlines specifically for clients who are members of the LGBTQ community. One
Mhm,
of them that I can think off the top of my head is the Trevor Project.
mhm.
So there are a lot of these free resources out
Right.
there that
There
people can
um,
access.
nonprofit organizations that are geared towards Native American
Mhm.
populations. You have to take the time and do the research to see, hey, um, therapy options for African American woman who lives in Florida. Do a Google search, see what you can find. For people with insurance, I want you to know that you've got see if your insurance or your employer has an EAP program.
Mhm.
EAP programs, employee assistance programs will help you at least get started. It will cover different ones have different number of sessions, but it for the most part, I think most of them cover maybe 4 or 5 sessions, maybe more.
Mhm. Yeah.
Look into those. Those are sessions that are available for you that either you pay a $20 fee to the EAP, or thank you, Tiffany, or
Thank you.
you got them all, girl. You pay a fee to them, or you pay nothing at all. So those are options. Check if you're on disability, check your disability benefits to see what options you have through your disability benefits. And then listen, maybe everyone's not open to it, but if you're a great negotiator, see if you can negotiate something, a payment plan. We mentioned
Mhm.
payment plan earlier. Maybe your therapist cannot drop their rate completely, because let's remember, you've got families, you've got
Mhm.
expenses. These therapists, these people are business owners,
We
or
have lives too.
they have lives,
Mm.
they have things too. So they may not be able to have a load of 25 clients and give 10 of those clients or 20 of those
Mhm.
clients discounts, because that affects their livelihood. But maybe in negotiating and having a conversation, you can come to some type of reasonable medium
Mm-hmm.
where you say, you know, on a payment plan, I can do this every 2 weeks,
Mm-hmm.
or however works for that particular
Mm-hmm.
clinician. And then I believe that there's like telehealth, like marketplaces, like telehealth marketplaces where you can kind of um, look through. I know like some insurances have like teledoc and
Yeah, like
some of those
Telemind. I think
telemind and some of those.
Triker has Telemind or something.
Yeah, so look
Mm-hmm.
into those because those are part of your remember you have insurance but you're not necessarily wanting to use insurance. Those are resources offered to you through your insurance. And I think for some, for I don't know how mental health is with Teledoc because I haven't used it for that. But I know, when we use Teledoc for like to see a primary care or just a
Mm-hmm.
regular internist, we don't pay anything for that because our insurance has already paid into that
Mm-hmm.
service for us. So look into those options, what other resources your insurance has available to you if you have insurance that is not necessarily you using the insurance.
Mm-hmm.
And all it takes is some time to research. It may take a lot of time,
Yeah.
but it's worth it for you to do the work, to do the research. We've got some on our website, some under our resources tab. We've got some links there. Tiffany
Mm-hmm.
just dropped us a bunch of
Yeah, thank you so
stuff.
much,
Thank you.
Tiffany. That's awesome.
Those you can take a look at those, screenshot it, copy paste it into a notepad on your computer. Take note of those things because as much as seeing a therapist in private practice is an option, there are other options out there.
Mm-hmm.
I would suggest whatever you choose, whatever you decide is the mode for you to go about this journey, that you thoroughly look into it. If the organization or product has a website, you understand what you are getting yourself into. Ask questions when it is private practice about what is expected of you,
Mm-hmm.
um, and and understand regardless what you're
Mm-hmm.
getting into.
Yeah.
If you're using therapy apps, understand what is expected of you, what is expected of the person you're communicating with,
Mm-hmm.
because these are options and we cannot tell you how.
Mm-hmm.
We're not here to tell you how to go about your journey. We're in private practice, but we know that may not be an option for everyone. So our goal with this is to tell you that you've got options. We've got a lot of options, and you just need to pick the one that works for you. Understand why it works for you, and why it may not work for you if it doesn't work for you,
Mm-hmm.
and then go about your journey that way.
Okay. All right. Well,
Oh,
we were not planning on being on here
it's
for
2 hours.
2 hours, but this is information that we feel like someone, hopefully one person, will benefit from and will be able to utilize. So the takeaway is that therapy should not be a luxury. We should all be able to
Correct.
access therapy when we need it. So we hope that this discussion was helpful for you if you're watching the replay. Thank you, Tiffany, Jody,
Thank you.
Cartessa, Steph, and all the other people who were watching the live with us,
Yes.
even if you weren't interacting, but
Yes, yes, yes.
we
We know
saw
you're
you on the
here.
live. So thank you so much for tuning in. And yeah, if you have any follow-up questions or anything like that we might be able to
Drop in
answer
the
for you,
comments.
feel free to comment or message me or Danielle directly, or send us a message through the website. We will be more than happy to help you figure this out.
Absolutely.
And I want to say that you don't have to be looking for therapy with us for you to reach out. We can't service everyone. We can't provide therapy to everyone. However, we will be more than happy to help you figure out how to navigate this very large system that can be very confusing
Yes,
at times.
absolutely.
So please reach out if you need anything. And thank you so much, Danielle, for all this
Thank you.
information. This was a
I
really
hope
great
it was useful,
conversation.
guys.
Yeah, hopefully. Hopefully.
Listen, and
Well,
don't be afraid to fact check anything I said. If I said it wrong, I am here to learn as well. So, if anything you need clarification on, feel free to message us, comment.
mhm.
We will try to, um, clarify anything that still may be confusing, because these are supposed to be short talks. We can only address but so much. So
Yeah.
if you have questions, let us know. We'll do our best to point you in the right direction.
Yep. And if you think of other questions or topics that you might want to know more about, let us know. We
Yes,
will be more than happy to do more of these conversations to give out free resources. So,
absolutely.
anyway, thank you so much,
Thank
Danielle. Thank you,
you. Have
everybody.
a good
This was
one.
fun. Bye.
Bye bye.